This is a Genomics Integrated Wellness Systems discussion of the medical provider experience. Once the medical provider has provided login and user ID password and logged into the system, he will be presented with the main screen for his particular location. In this particular example, we're looking at the Dallas clinic that the doctor is assigned to. The doctor has the option of looking at information that is available immediately on the splash page or the home page, or the medical provider has the option of looking at all the patients available for his particular locale, again, the Dallas clinic. The medical provider can examine one or many medical records as required for his particular medical experience on a particular given day. We can open up multiple patient records simultaneously and examine the information as required. In this particular example, we have Dr. John Bradley and we have Miss Female Patient PhD. Let us resize Dr. Bradley's medical record for the Genomics Integrated Wellness Systems software solution. We can navigate to biometrics. We can navigate to nutritional assessment questionnaires, the form to build. We can examine the diet, the lifestyle, and you will notice that we can add one or many records per category. We can also examine the environmental impact, his nutraceuticals, pharmaceuticals as required. We can also delve into the patient's genetic records. In this particular case, we have, after the form builds, the metadata concerning his test and all other pertinent information. We can also delve deep into the actual genetic markers that are attached to specific chromosomes. In this particular case, I'll examine chromosome number 7. For the patient, the genetic marker has been identified for this particular chromosome, the expression level, and the date of the identification of the expression level. We also have medical records. Our system provides electronic medical records for both Microsoft Word and PDF formats. We have a section of the application for each medical record for medical comments from the medical provider. We also have a non-editable, HIPAA-compliant audit trail for who has touched which portion of the patient's record and when. The data goes back to the origination of the system's record for this particular patient. Again, we can open up multiple patient records simultaneously. When the information is displayed, analysis can be executed. We also have the option, in the case of our machine learning algorithms, allow the form a moment to build, to populate the information for, in this particular example, blood, in the blood analytics that are typically provided. We can examine the clustering algorithms. Allow a moment to build, please. And there is our 1 to 3 seconds to produce a primary diagnosed conditions for this particular patient based on blood analytics, and this is a clustering model. We can also examine the association models for the same patient, different models presenting information in different formats. This is the typical experience that a medical provider will experience with our particular system. We can also add patients, very simple. We provide a first name, we can add title, Mr., suffix, the third, and email. Once the information is entered, you also have the option of looking at all the patients available for this particular case, the Dallas Clinic that this patient is being added to. Once you are satisfied with the information, save changes, the patient record form bills, and again you can progress through the information as required for biometrics, nutritional assessment, and again you will be adding records as required, and you'll also have your non-editable audit trail. Once a physician has completed the management of his day-to-day process, he also can delve deep into the genomic analysis and analytics as provided by the Genomic Integrated Wellness System. We can examine a myriad of informations available that pertain to particular patients, everything from, this is a two-dimensional genetic marker analysis, so we can look at genetic markers and biometrics, genetic markers and diagnoses. We can also examine much information pertaining to the diet, in this case genetically modified food for processed and non-processed. We can also look at genetic markers and pharmaceuticals as our database becomes available. We can also delve into information regarding 3, 4, 5, 6 dimensions of analysis. We can also look at genetic marker recommendation engines. In this particular case, how the diet affects a particular genetic marker, how health, the information for lifestyle, environment. We also have, again, recommendation engines for health insurance and life insurance based on the presence of a particular genetic marker. And again, we can go into pharmacogenomics, information-based medicine, and again, this is available within the system because of the depth of information that we maintain and strive to make available to medical providers. Again, this has been a discussion of the Genomics Integrated Wellness Systems medical provider experience in terms of using our software solution on a day-to-day basis. Thank you.